Hello, and thank you for tuning in to this special report. I'm Glenn Martin, the host of Prescott Talks, working for Prescott E-News. And today we're going to be talking about the COVID-19 virus that's on so many of our minds. Today I'm joined by Steve Everett with the County Health Department and Dr. Askari from Butte Medical. And we're going to discuss and ask some of the questions that are out there. To be honest with you, I watched the news yesterday and I observed on Facebook so many questions out there, and I contacted our editor-in-chief and said, we need to get some information out there for some of the folks who are asking these questions, and I couldn't think of two better people and experts in the field. So, Steve, my life has changed a lot because of this. I mean, it was just within the last couple of days. Yesterday, I went to Costco to get gas, and I didn't wait, but I saw people waiting for toilet paper. So, things are really starting to go crazy. And what can we do to help our community and understand that the seriousness of this virus and how we can live our daily lives and not be in panic and fear?
Yes, panic is something you definitely do not want to do because that's even more contagious than COVID. But you start seeing one person loading up on toilet paper, then you start thinking, why is he doing that? Maybe I should do it too. And then other people see you doing it, and it escalates.
Yeah.
What I've been recommending is we want people to have a 2-week supply of food as backup, and just to be safe. Just when you go shopping, instead of buying 7 days of groceries, buy 10. The following week, do the same thing. There's your 2 weeks.
Yeah. Gotcha.
And the stock will be able to keep up, and everyone will be able to get what they need.
So there's shortages going on right now, but
Yes.
I worked in the grocery business, and I know for a fact that's going to be a very temporary thing. Would
Yes.
you agree? Sometimes we get caught off guard on wants and needs from our public, but for the folks that are watching us right now, give us a few days, and I think the grocery stores will be filled back.
Yeah, for sure.
Dr. Askari, one of the things that was a question out there was, is COVID-19 a flu or is it its own identity?
Its own identity, and I have to reassure people in Yavapai County that we're blessed in a way that we have no reported case as of today, as of this morning. And there are 3 different elements here: coronavirus, common cold, and flu. And they all present with different signs and symptoms. Coronavirus comes with fever, dry cough, noticeable shortness of breath, severe shortness of breath, and it appears actually, the symptoms started actually 2 to 14 days after they caught it. However, common cold, it presents with sore throat, scratchy throat, and a little cough, runny nose, dry eyes or runny eyes, and head pressure type of symptoms. While flu is like more a muscle ache, high fever, and then what I would say, chills, dry cough. They don't produce any phlegms or anything like that. So those are the main 3 different to differentiate between these 3 elements.
Gotcha. And when we talk about the symptoms, what would we do if we did exhibit any of those symptoms? In other words, I'm at home, I'm starting to get a fever, I'm having a cough. Do I go to an ER? Do I call the doctor? Do I call the health department? What advice would you give the public that if you do exhibit any of these symptoms, where do we go and what do we do?
Okay, well, if you're just having mild symptoms, don't go to the emergency room. Call your doctor, and he will advise you whether to come in. If he thinks it's just a regular flu, he may just have you stay home since the symptoms aren't bad. There's no cure for flu, so it's mainly just relieving your symptoms.
And what would you advise, doctor?
I advise people to stay home, and then we just started hiring about 10 physicians at our clinic, So we would go to the patients and do house call for them from 7 a.m. till 9 p.m. And then, so we're on the field, go seeing patient and take care of them rather than people, even if we get one case, God forbid, or two cases coming to an office where 50, 60 people sitting, or any multi-specialty clinic, large clinics or emergency room, it would be a tragedy. So I advise people stay home, call us. We're available for you. We come to see you at your house, rather you guys come to see us within at least next 2 weeks until we see where we're going, which direction we're going.
Just to make sure I understand, you guys are doing house calls
Yes.
at Butte?
Yes.
So we'll make sure we get the telephone number up for that.
Okay.
So call that number, and we have dispatchers, and then we have doctors in Prescott Valley, Chino Valley, Dewey Humboldt, Prescott mainly, at least about 10 physicians available to cover the people when from 7 a.m. till 9 or 10 p.m. will be available to help them out rather than they come to us.
One of the things I believe anyway personally is it's better to be safe than sorry, right?
Yes.
So
Right.
if you're
Yeah,
doing
if you
that,
have symptoms serious enough where you think you would be hospitalized, go to the hospital. Call first so they can expect you. But to go to the hospital, if you're having mild symptoms, don't go to the hospital because they're just going to send you home and you'll just be sick again and have a big bill to pay.
If it's an emergency, God forbid, chest
Yes.
pain, severe headaches, you got to call 911. But if you feel like, okay, you're experiencing cough, chill, fever, call us.
Yes.
You don't need to go. Emergency is packed. All the hospitals are packed. There is no bed in the hospitals. So call us. We will evaluate you. And if we feel like you need to go to the hospital, then we call the 911 or we will transfer you to the hospital
gotcha.
to make life
Yes.
easy for them.
Yes.
Yes, and to help our paramedics, to help our emergency physicians, to take the load of emergency physicians because they're bombarded. The hospital beds nationwide are full. So there are cases that not necessarily need to be panicked and stay home rather than occupying a bed of a hospital when somebody really needs it.
Yes.
Gotcha.
Yes.
Good
Even if this is
advice.
happening, still people are still breaking bones. People are still having heart attacks.
Yeah.
So
Right.
save it for
There's
them
other
as
things
best you
going
can.
on.
Yeah.
There's a lot of talk about a test for this virus. Are
Oh,
those tests
the test.
available? Or
It is available actually. The coronavirus test is available.
Oh, is it finally available today?
All the
Okay,
local.
good.
What the CDC was recommending, and then they were giving free kit test to emergency room or hospitals and some urgent cares that they were close to the large cities. But the test is available through a sputum test or nasal swab. The sputum is more accurate. It's just we can get the result back within 24 hours and then see if they are contained with flu or any type of pneumonia or God forbidden coronavirus.
so it takes about 24 hours.
24
to get
hours to get the test result back, yes.
So if somebody's sitting at home and they're wondering if they do have it, I guess there's no facility that you can just go and get tested. You do have to see a medical professional.
We do. We will take the cup with us. We will take the kit with us. We will do it. We get a sputum sample and we send it to our local labs, and we will have the test result next day. We will call the patient and we will discuss it with them. If it's if it is a contained coronavirus, then we will, as he mentioned, our hospital is prepared for isolation or quarantine. Those people need to be in quarantine. I know as of yesterday, I heard that the only hospital was really equipped with a large facility of quarantine was Honor Health, but I'm sure Banner and Dignity and Yavapai, they're all working to get prepared, or they already have it as of this moment that we're speaking.
That's great to know, Doctor, because again, a lot of people on the Facebook and the internet have been asking and inquiring about those tests. And I think that's become a large issue, Stephen.
Yes, it's
even
been
with your reaction, I
a
can
lot of
see
confusion the past few days.
that. And the doctor has answered it, all you have to do is make that phone call
Yes.
and you would be
Yep.
able to get that test. So great news for the community. So how is the hospital prepared, Stephen, if this, God forbid, started becoming more and more people started showing up with positive for COVID-19? are we prepared, and what emergency steps have we taken as far as county health?
We're prepared. We've been ready for this for 18 years, really, and we did a lot of work, especially with the swine flu back in 2009. So we have very detailed plans on what we need to do. But of course, like anything else, underfunding, understaffed, undersupplied, we're just going to run out of things. So that's what we're trying to do, is not necessarily eliminate it. If it hits, is to kind of suppress it a little, to kind of space it out so hospitals don't get overwhelmed.
Yeah, and the personnel would be one of the questions I would have.
Yes.
Do we have the personnel? Do we have the equipment if somebody needs to go on a ventilator, or something like that on a serious case? Are we prepared for that?
Yeah, stuff like ventilators, they can only handle so many people, so they'll triage people. So the people that really need it will get the vents, and they'll do it. I can't guarantee that there won't be deaths. This is something that's about 2% of the population 2% of the population are expected to die. We're seeing really bad, if you're following Italy, they're seeing a lot of deaths of their seniors, and you just run out of supplies and you try to do the best you can.
It is a tragedy. I was talking to one of my greatest doctor friend back in Iran, in the state of Kerman. There were about 4,000 people were dead. I'm sure they're not releasing this news, including 8 physicians. So it is a tragedy. Our best choice, our best tool is to stay home and pray to God that it doesn't hit us hard. And to me, again, staying home is the key. For 2 weeks, even if you don't exercise, just walk inside the house, go around the house, but avoid areas where there is a huge population or there is gathering. So I would really avoid going to a high density population. And then this way, even if 1 or 2 cases are there, we would not spread it too fast.
It's interesting you say that, doctor, because we were talking earlier, for us who go to the gym, so you wouldn't recommend even taking a walk around the yard, around the block or anything like that to get our exercise. We do it within the confines of our own home.
You can go outside, but the most important thing is to keep space between you and other people. So if you're walking down one side of the street, make sure everyone's on the other side of the street.
The other things, avoid hugging, avoid kissing,
Yes.
avoid shaking hands, wash your hands frequently. Those are a huge matter that we could prevent spreading it out.
It's something I saw on TV yesterday. They were talking about the sanitizers and the
Yes.
wipes and everything.
Yes.
They said the most effective thing that we can do is wash our hands.
That's
Right.
it. Sanitizer never ever been scientifically proved that would do anything for any type of viruses or bacterial infection. It's just they market it nicely to sell it.
Yeah, yeah.
So just wash hand with soap
Yeah.
or just wash your hand.
Yeah.
Simple.
Right, yeah, you want to use, the best is using soap, but the real important thing is you use a lot of friction. You want to rub your hands 30 seconds and really rub it, because that's what loosens everything up. The soap is really there to help with the friction and to break down the oils in your hand. So you're catching more things.
I was watching one of the doctor shows the other day, and they were showing the fingertips, in your palm.
Yes.
To make sure that you get your whole hand and not just your fingers. So that was interesting. So we need to go get gasoline, and we're touching the pumps and that kind of stuff. Do we want to put sanitizer on right away afterwards?
I would wear gloves.
Wear a
I
glove?
would wear a pair of gloves.
Yeah.
Plastic gloves. Any
As long as
type.
there's a barrier.
Yeah.
You don't have to clean off the handle, long as you're not coming into contact with it.
So, yeah, so I went over to, and believe me, I am very cautious, personally. I don't want to stop living, but I don't want to expose myself either. So I went over to Harbor Freight and bought a box of the nitro gloves, so that if I do need to go out and do gas pumping or anything like that, I have a throwaway glove that I can do that. Would that be something
Yep.
you guys would recommend?
Yeah, in a gym,
Absolutely.
you could use a paper towel. They have the towels there. You can take that, wrap that around the handle. As long as there's some kind of barrier, you're protecting yourself.
And Harbor Freight just got a commercial from me, so you know they might want to make sure that my card is working real well there. But yeah, great information. Again, preventative measures that we
Yeah.
do. Is there any other preventative measures that you guys can come up with that that I haven't asked, as far as the gloves, the washing our hands, not touching our face, obviously. Anything else that?
Cleaning surfaces.
That's a great one, yeah.
Yeah, because when you sneeze, it's transmitted by micro droplets. It's not an airborne one where it stays up in the air for hours like measles is. It'll go out, then fall on your surfaces. And it can stay alive. They're estimating about 8 days.
8
Last
days
I read.
alive on a
Yes.
surface?
Yeah, so you want to wipe down the surface with an antibacterial, antiviral sanitizer. And it'll say right on the bottle like Lysol. And the important thing is not to wipe it. Let it air dry. The longer it stays wet, the longer it stays active, the more virus it'll kill.
I think that's a lot of misconception, is where they spray and then they just wipe it off and dry it. It doesn't, Lysol does not work that fast.
Yes.
Clorox bleach and all these wipes, you have to allow it to sit
Exactly.
and air dry. So that's an
If you're
important
washing
point.
windows, yes, you wipe.
Yeah.
Tables, no.
Yeah, gotcha. Wow. So how long can you? I guess that just answered my question. One of the questions I had is how long can it live outside of the body? 8 days is what you're telling me.
It's different for different surfaces. Hard surfaces, it can live up days. For soft surfaces like clothes, paper, it will live less. On certain metals, it'll live even shorter. I'm getting tongue-tied. It'll live even shorter because some metals have antibiotic properties, like copper. So it won't last as long on that.
You guys are giving me. I'm like, holy moly. I mean,
No, I'm pretty sure the vaccine is already produced. Vaccine is ready. I was talking to some officials. They said the vaccine is ready. We just need to get FDA approved. Generally, FDA approved for any type of medicine or vaccination, it takes from 1 year to 10 years to 9 to 10 years. But they're pushing. President
Yes.
Trump is pushing this to go through very fast. So I expect within the next couple of weeks, we would have vaccination for children and adults, with God willing. Now, Roche Pharmaceuticals actually announced this morning that they have produced more kits, millions of kits coming in to do more testing, as they were comparing us to the rest of the world. We have not been doing a lot of tests. So, but it is misinformed that testing is available. It's a sputum test. It doesn't need to be a kit. So now there are more kits coming. That's a good news. The sputum test is good. The nasal swab test is good. At least we can identify those people and avoid further tragedy.
Right.
Yes.
Wow.
And for those that are thinking, why can't we just speed it through testing? The older population may remember thalidomide. And that was marketed to women for morning sickness. And in Europe, they rushed it, and it caused deformed babies.
Damage. You have to make
Yes.
sure that it's safe for everybody.
Exactly. So that's
young, old,
that's
and
what
in
the
between.
testing is for. So
Gotcha.
they're rushing it as fast as they can, but there's certain things always have to be checked off.
Doctor, one of the questions that were out was, or one of the questions that was asked was, can we wait a couple months and just our environment getting warmer and drier, will that affect this virus and start killing it off?
Absolutely. I think that's one of the things that we're waiting. But before that, I think we will come with the vaccine. We cannot let the world get so many million people get killed and not FDA approving the vaccination to be released to the market. I have a feeling that they're going to release it soon. And let's pray to God that they would do that to avoid waiting for a few more months of warm weather.
Will this reoccur next year during flu season, do you believe, or do you think we'll have a handle on that? I mean, I know I'm asking you to look into the crystal ball, but your belief as a doctor, do you think that we will have that under control or have some kind of handle on it by next year?
I think so, 100%, yes.
Good. So one of the another question I had was, if you contact this and you recover, are you susceptible of getting it again? Can it reoccur?
Technically, you'll get immunity from the strain that you were infected with. It'll work like flu. There's different strains. They've already identified 2 different strains of the COVID-19. So it's not known how much protection getting sick from the first one will protect you from the second.
So
Yes.
that was another one of my questions, is how many strains are out there? Jan sent me an email this morning saying, ask how many strains, we hear 2. Are there more, or?
There's 2 identified.
2 identified.
Yeah.
The sad part would be, this is what we call it in a different term, biological warfare. Mm-hmm. I hope that's not the case scenario. I hope it was just a mistake. One virus went out, and then the Chinese guys got it, and then it spread it out, and then the guy went to Iran, and then to Korea, and then to Italy now, and then now it's pandemic. Right. I hope there is no more problem or more viruses coming up.
Yeah, there was a lot of things going on when that first came out that, again, we've heard the saying that it's a bioweapon, that it was weaponized, and how it mutates and morphs every so many days and would cause somebody to be always chasing a serum or something but has that been, I don't think, those are all conspiracy theories from what I understand, but I don't know
the mutation,
how true
the mutation is natural. It does mutate a lot. It's because it's a what's known as an RNA virus. You think of DNA, RNA is kind of like half a strand, and it mutates very quickly. And same thing with flu. So there's 2 known strains. There's probably loads of unknown strains. Some of them lead nowhere. Some may be more lethal. Some may be less lethal. Some might not even affect people at all. With SARS, that's what happened. Is we caught it. It didn't it mutated into something that became not a problem.
So, just to relieve the folks that might be watching this, we have 2 possible cases here in Yavapai County that are being tested. Okay.
Nope. We have no cases, and we have no active cases being tested.
And there's not been anybody sent to other regions to be tested? Because, again, I'm reading all these little tidbits on Facebook. They're going, they're sending them down to Phoenix. That's not happening.
No.
Can you confirm that?
No. We get notified of residents.
Right.
So wherever they go, if they go down to Yuma, we'll still be notified.
Gotcha. And if there was one that was or if there was a confirmed case, obviously that would be a public knowledge as well.
Yes. Yeah. So if you're wondering if there are any cases, go to the health department website first. Go to the health website first. You can edit that part out.
Yeah.
And it'll say right on there, if it says we have 1 case, it'll be there. If you don't see anything, we have no cases.
We're going to report it to the official and then put them on quarantine, yes.
Right.
Yes.
Yeah, let's go to the source.
Exactly.
Don't go to Facebook, you guys. Let's go to
Yes.
the source. Because there's a lot of information or disinformation.
You don't want to put patient privacy and HIPAA violation. You want to just get to the CDC, and then they know where to go from there.
Good point. Is reporting mandatory?
Absolutely, yes.
Yes, what happens is if they're tested by the state, obviously it's going to get reported. The private labs automatically report as soon as they put the positive case in their computer. The computer notifies our computers.
Gotcha. So, Dr. Askari, who would be high risk?
High-risk patients are people who are what we call immunocompromised, people who are on chemotherapy, cancer patient, MS patient, patient on radiation therapy, diabetes patient. Those are mainly the high-risk patient with end-stage COPD. Mm-hmm. Those are what we call immunocompromised patients. So those people need to be watched very, very carefully.
Stay at
And
home.
also people above age 85 plus, their immunity system naturally goes down. So those are the people who are at high risk patients.
So-
Also babies, babies, infants. Their
So the
immunity
very
system,
young and the
yes,
and more
Yeah.
elderly.
up to 2 years or 1.5 to 2 years, their immunity system is not built as strong as adults.
I got you.
And elderly and the rest of what we said.
Good advice. Anything to add on that, Stephen?
That was pretty much covered it, and I think it's important to say if you do get COVID-19 and you have mild symptoms, don't immediately assume everyone else is going to have mild symptoms too. So it's really a roulette wheel. The symptoms you get, one person can get mild symptoms, one person can have severe symptoms, and otherwise you're totally the same.
And the people who are high risk, there are opportunities for, like, if you do need services like food or something, there's home delivery where they can come and deliver your groceries right there at home. Basically put it out on your doorstep so you can pick it up afterwards,
Exactly.
So there are options out there within our community to, again, hold back from that exposure to everybody who might, be at high risk.
Yes.
There are two companies in this town that I have such a high respect for them. It's Meals on Wheels. They could deliver some food for those people, and also people who care. If they need to be transferred to somewhere, to a hospital, or they're really sick, they could use those people, because we don't have Uber and taxi services as many as the other big cities have. So reach out to those people, and then I'm sure they're available to help you out.
And you hit something very dear to my heart, and that's about Prescott and the people that live in Prescott.
Yeah.
If we have a neighbor who is sick or needs our help, I think the majority of us, if not all of us, will always be there to help our neighbors.
Exactly.
Yes.
The people of Prescott are beyond compared to so many other big cities. We watch out for ourselves. I know even when a snowstorm happens, I go around with my Jeep and make sure my neighbors are able to get out of their driveway if they need to. And the same thing here. It's not that I want to, give that exposure, but, if I have a neighbor that I know is sick or elderly and can't get out, or maybe one of the high-risk people that you spoke of, Doctor, you bet I'm going to call them up and say, what do you need at the grocery store? Let me go shopping for you and get that to them. So there's so many different ways of serving our community.
I'm sure you all know Pat Kirkender. Pat is amazing, and he has so much connection with veterans that they could come and help. So don't forget about him. He's a great guy. He is such a big help to every function and event I had in my house for fundraising for firefighters. These guys were amazing. So reach out to each other and get help and move on in any direction we need to do.
Work as a community. And I just received an email from Heights Church. I go to Heights, and they're going to do the services online so that that we're not exposed to each other within our in our services. So these are the kind of things that we're working smart. We're doing things the right way, staying away from large crowds. And we're still living, I'm still gonna get to see Pastor John this Sunday. I'm gonna do it inside my house in my living room, that's all.
Yeah, it's kind of the paradox of the disease, is that you want to stay away from people, but you need those people to help you.
Yeah, great point.
And I'm sure Mayor Mangrelli, Scott Masher, Chief Black, all of these people are available with their team of support. So we can always reach to them. They've been always supportive, and we as a community need to protect our residents. And with the God willing, we will prevail.
All right. And our small business, again, we don't want to shut down our small business because of this. Right now, if you're not able to, support small business going out, maybe buy a gift card sooner or later, and so that we can do that, so they can, keep that cash flow going. Because we certainly don't want to lose our small business. That's the lifeblood of our community, especially here in tourist town, because it's going to be affected, and we all know that. So let's support our community any way that we can. And,
Amen.
Both by service and economically as well. My last question I have here from somebody, again, this was Jan. Do masks help? People who I see walking around with masks on in public, does that help?
Not in Yavapai County to me, because we haven't had any cases. So people are in a panic mode. Even if we don't tell them, hey, don't wear the mask, they're still going to wear it. To me, it is not. Unless if we see, okay, there were a pandemic area, there was this city, there was a place in New York, there were 40 cases identified. This morning on news, I saw that. Yes, in that area, yes. But in Yavapai County, where we have 0 cases reported, I don't see there is a necessity of wearing a mask.
Right. And once it starts going, the mask doesn't protect you very well from it, but if you have it, it'll protect other people.
Gotcha.
So if I'm wearing a mask, I can still get sick, but you two are protected. If you two are wearing masks, I'm protected. So you're protecting other people. So if everyone wears masks, then you're helping everyone stay healthy.
So just to kind of sum this up, Doctor, and Stephen, again, thank you again for coming on
my pleasure.
and getting this information out. The way I see it right now is we have no cases in Yavapai County.
Correct.
But that does not mean that we should not be vigilant and that we should take precaution.
Absolutely.
And that we stay healthy within our own homes. We reduce the risk by not going out. Get some supplies at home, some food that where you don't have to go out to the store every day, and just be smart about
Yes.
where you're going, what your exposure is. Wash your hands, use your hygiene, your good hygiene, and who knows, we might not even have a less flu season next year if we keep on washing our hands and doing the
Exactly.
things that we were supposed to be doing all along.
Yeah, take this time now
Yeah.
to prepare, and by the time it does arrive, we're pretty much considering that it's inevitable. So prepare, so everything, by the time it hits, everything has become habit.
I have one more suggestion. We're going to be extremely cautious for people coming from out of the state or out of the country. So Chancellor of Embry-Riddle University called me 2 days ago that some of their students coming on Saturday or Sunday morning, and would you be willing to come and help us to screen because our clinic is closed? We said yes, so we prepared about 6 of our medical assistants go and then do a screening testing for students who were abroad or they were out of state, they're coming here. So entire Sunday evening and the entire Monday morning, we're going to do the entire screening for the Embry-Riddle students.
Right.
And then if any other institution that I'm not aware that they have people coming out of the state or people are coming from within the states, we're going to be cautious with those and ask them, or if you identify some of those guys, they need to be screened. They need to be tested.
How about people who are coming back from, let's say, a cruise or being over?
Absolutely.
They should self-quarantine
Yes.
for 14 days, is that?
I wouldn't do a self-quarantine. If they have symptoms, they should be tested. If they have no symptoms, they should stay home for at least 14 days, yes.
Good advice.
Yeah, and if it's a long-term cruise, 3 weeks, 4 weeks, the first case would have shown up by the
Right.
time. That's what happened with the quarantined cruise ships. So even if you have like a 3-day cruise, 4-day cruise, you should still be aware of the symptoms, watch out for them, and quarantine yourself as best you can.
Final words, Doctor.
Pray to God. God bless us and stay home and keep praying.
Yeah. Stephen?
Wash your hands, don't panic.
Don't panic. Great. Well, thank you very much for taking the time. I hope you found this to be informational. Again, we're trying to get as much information out to our public as possible. I want to say thank you again to Dr. Askari for taking his time today to come down and meet us here. And Stephen, again, you. And this is the way we do it now, right, guys?
Yes.
Thank you, guys.
And don't forget repeat our numbers, 1-800-1855. Numbers, call us. If you're sick, if you're not feeling good, call us. We come to you rather you guys come to us.
And we'll have that up on our screen as
Yes.
when we show this. So again, guys, thank you so much.
Thank you.
Okay, thank you.
And thank you, Prescott.
Thank you.